The Chapare virus, a member of the Arenaviridae family, was first identified in 2004 in the Chapare province of Bolivia, from which it derives its name. This rare and potentially lethal virus initially came to medical attention when a single human case presented with severe hemorrhagic fever. Since its discovery, the virus has remained relatively obscure, with only a few reported cases, but it has gained attention due to its potential to cause severe illness and the possibility of human-to-human transmission. The transmission of the Chapare virus is primarily believed to occur through direct contact with the bodily fluids of infected rodents, which are considered the natural reservoirs of the virus. This transmission pathway can involve handling the rodents, their excreta, or materials contaminated by their fluids. In addition to zoonotic transmission, there is compelling evidence suggesting that the virus can be spread from person to person. This typically occurs through direct contact with the bodily fluids of an infected individual, making scenarios such as caregiving, medical procedures, or handling tissues and fluids without proper protective measures particularly risky. The clinical presentation of Chapare virus infection is characterized by a wide range of symptoms, which can vary significantly in severity. The illness generally begins with a sudden onset of fever, often accompanied by severe headaches, which are a hallmark of many viral infections. Patients frequently report generalized body aches, with particular intensity in the joints and muscles, contributing to a debilitating condition. Gastrointestinal symptoms, such as nausea, vomiting, and diarrhea, are also common and can lead to dehydration and electrolyte imbalances if not managed appropriately. One of the most concerning aspects of Chapare virus infection is the potential for hemorrhagic manifestations. Patients may experience bleeding from mucous membranes, such as the gums or nose, and in severe cases, there may be evidence of internal bleeding, such as hematemesis, vomiting blood, or melena, black, tarry stools indicative of digested blood. The presence of bleeding significantly worsens the prognosis and necessitates urgent medical intervention. In addition to these symptoms, some individuals may develop a skin rash, which can vary in appearance and distribution. Abdominal pain is another reported symptom, adding to the overall discomfort experienced by patients. As the disease progresses, the risk of severe complications increases. Multi-organ failure, characterized by the simultaneous dysfunction of multiple vital organs, is a critical condition that can arise. This may be accompanied by shock, a life-threatening state where the body's organs do not receive adequate blood flow, leading to a rapid decline in health. The management of Chapare virus infection is primarily supportive, as there are no specific antiviral treatments currently available. Medical care focuses on stabilizing the patient, managing symptoms, and preventing complications. This may include fluid replacement, pain management, and, in severe cases, intensive care to support organ function. The implementation of strict infection control measures is crucial to prevent the spread of the virus, especially in healthcare settings where the risk of transmission is heightened. Due to its rarity and the limited number of cases reported, the full spectrum of clinical outcomes and the long-term effects of Chapare virus infection are not well understood. Continued surveillance, research, and public health preparedness are essential to better understand this virus and mitigate the risks it poses.